Good afternoon for you folks on the East Coast and Central Time, and good morning to you folks on the West Coast. My name is JT Keating. I'm the SVP of Marketing here at SignaCert, and we'd like to thank you very much for joining us for our webinar. We're going to jump into it real quick here. We're going to be very respectful of your time and hopefully blast through some content. First, I'd like to give you just a couple of the usual housekeeping things. We're going to follow the standard format of the experts giving you guys the information that you came here to get. Throughout the entire session, if you can please use the question section that's on the side and send in any questions that you have for the period of time at the conclusion of the formal presentation. That's always, in my mind, the best parts of these is actually running through the questions, and chances are if you have the question, somebody else has the question. So if you could please give those to us, that would be great. Also, if you need to, if there's any kind of technical issues, audio issues, whatever the case may be, feel free to use that same thing as well. We will make slides available after the conclusion of the presentation. Anybody would like it, as well as an archived video recording that you can watch yourself and/or share with your friends. So with that, we're going to hop right into it. The main part of the presentation on cyber breaches and HIPAA, what's required now. Robert Phelps, the CEO of Third Rock, an expert in this space, is going to be driving the majority of the content, and he's going to be joined by Tony Jennings, who is the CEO of SignaCert and a former Air Force information warfare gentleman. So he's been in and around this kind of a space for quite some time as well. So with that, what I will do is I will hand it over to Robert, and Robert, it's all yours.
All right, sorry, it wouldn't unmute. First of all, let me thank SignaCert for sponsoring us today, and hopefully you guys will find this educational and some enlightenment on cyber breaches and how to deal with them and on the new HIPAA requirements since 2009. And as JT said, I'm going to try to be pretty quick about this, but there will be question and answers at the end, so if you miss something, just feel free to ask us and we'll try to answer your questions. The agenda for today is we're going to go over the real threat of cyber breaches, why recent HIPAA changes are important to understand, how to reduce the potential fines for HIPAA non-compliance, and we'll cover steps to protection and compliance. We actually have a HIPAA quick check you can take online to see where you stand. And then why reducing discovery time of a breach is critical. And then we'll go into the question and answer discussion. So the recent headlines, everybody's probably seen about Home Depot, Target, JP Morgan. There's been lots of credit card records hijacked or stolen. And last year, there were several large healthcare industry firms that were breached. Community Health Systems probably had the most records, 4.5 million records were taken. But it's important to notice down at the bottom, the highlighted ones, Anthem and Primera this year have already had 91 million healthcare records stolen. And then the last one we included was Advantage Dental, just to show that a small company is not an exception. The cyber criminals use automated processes, and so Advantage Dental is a small dental service provider in Oregon. They were breached and had 151,000 records stolen. And the estimate is about 70% of cyber breaches occur in small companies. So the news is, the large companies hold the news, but it's happening to everyone. So the takeaway is healthcare and PHI is now the target of cyber attacks and cyber criminals. So the question used to be, were you breached? And it was, in the past, it was not if you will get breached, but when will you get breached. In the last few years, it's really become not when will you get breached, but how long will it take you before you know you were breached. So identifying that you've been breached. And Adam Levington, the Georgetown law professor, has stated there's really no way you can be connected to the internet and keep things safe. And the stats are proving that more and more every day. So HIPAA threats, what are the big concerns in being HIPAA compliant, and what can cause an audit, and how can you get in trouble from not being HIPAA compliant? And a lot of people think it's the audits, but breaches are actually about a 20% probability now, and that's based on stats. The last bullet there under that is 42.3% in the healthcare industry. So there's a large likelihood that your company will be breached if you're in the healthcare industry. Audits are a concern, but it's a low probability. And if you are breached or if you are audited, it's important that you have the right attitude and you work with the agency and you give them the information they request. So obviously being prepared, and that means you need to be document. You have to, the key is document, document, document. They want a risk management plan in place. And also be aware that your patients can now turn you in for an audit. So if they feel like you're not protecting their information, then they can actually file a complaint and an audit is automatically started. And then the last thing that we're seeing with clients that we talk with is denial and misunderstanding. They think they're compliant, but they're really compliant in privacy side of HIPAA versus security side. And we'll discuss that further in the next few slides. And then we find it's really important to trust but verify. So when you're talking about your IT shop or you're talking about your MSP managing your IT, you really want to ask them to show proof that your systems are secure. So the takeaway is breaches are the issue, compliance is the required defense. And a little bit of history about HIPAA, as we just mentioned, privacy is what it was about up until 2007. In 2009 through 2014, the laws have been put into place that really focuses on security, the electronic PHI. So what we're finding on that is that it's much lower compliance. So the takeaway is many new requirements to be compliant and secure. And a little bit about HIPAA in more plain English. What you were doing was privacy. It's no longer sufficient, and it's really HIPAA awareness training. There was privacy focused in the office, in a practice, or in a hospital. Auditors came in, somewhat of a checklist approach. You could actually purchase policies and procedures, and you assume that IT or your MSP were taking care of the situation. What they're now looking into is, or requesting and requiring is that you need to know what's going on and you need to take far more steps to secure the data. So the first thing that they've really gotten harsh about and wants you to do is an annual risk assessment that is documented and has a remediation plan. So how are you going to make your business run better, be more compliant, and protect the data? That includes encrypted PHI data and email, continuous network security monitoring on all devices, annual HIPAA staff and specialized management training, which should be based on your policies and procedures, customized policies and procedures that are enforced, so you actually need a policy to enforce your policies and procedures, and business associates agreements that need to be verified, so you actually need to enforce compliance on the business associates that can touch PHI and ePHI. HIPAA compliance activities need to be recorded, so anything you change that's related to HIPAA or security needs to be documented. And a customized contingency plan with emergency response plan in that. And all of this drives a risk management plan. Our risk management plan should be put in place to drive all of this. And our goal is, the plan we put together is to maximize your protection but minimize your burden. So you just make it part of your culture. So the takeaway is, know what is required to be HIPAA compliant. This is a quick check we put together. I'm not going to spend a lot of time on it because it's basically the same as on the previous page. It is available out on a website. You can go and take this to see where you stand, and we'll have it up on the last page so you can write it down and go take that test. And anything less than a 10 means you're exposed. You need to work on that area, basically. So the government looks at the tiers and actually defined them recently, and this is to help set levels of fines based on how compliant you are and what your attitude is towards compliant. So on the right side, at the top tier, if you're not doing anything, they just look at it as you being negligent, and the fines are going to be the highest possible they feel they can fine you for. It actually leaves you exposed to breaches if you're not doing these things anyway, so it's actually a business impact too. And on the left side, as you correct things, you implement a compliance plan, you would drive the fines down to the lowest possible amount, and sometimes they won't fine you. There's actually been examples or incidents where they've had laptops stolen, and if they could prove they had a good secure password and good encryption on the hard drive, there was no fine. So the takeaway is to improve your compliance to reduce potential fines and breaches. A few examples of the fines they've done over the last year or so. Two that I wanted to point out. The Blue Cross one for $1.5 million was for 500 subscribers or 500 records. And for the same number of records, you'll see that the Hospice of North Idaho was only fined $50,000. So this is an example of Blue Cross being at Tier 4 and the hospice being at Tier 1. So the takeaway again is being compliant and secure greatly reduces your fines. So what Third Rock did was, being in this industry and working in this, we looked at it and said, you know, no one's really solving the entire problem for the practice or the healthcare provider. And we looked at all of the things that are required, these 10 items basically are the large categories, and decided to put together a solution that covered all of those, and that's the blue chart on here. So the idea in the chart is that as you start implementing your compliance program, you start driving down into lower tiers of fines, and you actually start improving your security to protect your data. And the idea is to drive it down to Tier 1, obviously, to reduce your fines to minimum or no fines. And then we've also had questions from our clients that ask and say, well, I'm just starting, or I haven't got all of this done completely, so what's the, you know, is the order across, or is there a better order? And that depends on where you stand, but we now have come up with a high impact solution. And the idea behind that is to start over here on the number 1 with unbiased professional risk assessment, and then in parallel or immediately check and make sure that you use encryption if you're sending out emails, and then continuous security monitoring to protect your data on your systems. So the takeaway from that is that each step reduces the liabilities, and you just need to start. And there's obviously a risk of damaging your practice and reputation. There's lawsuits from the lost patient data, costly breach remedies, expensive audit fines, and negative social media from a breach or from a HIPAA audit that fines you. Robert Mueller, the third director of the FBI, has stated there are now only 2 types of companies left in the United States: those that have been hacked and those that don't know they have been hacked. And that he made that statement, I think, probably 2 years ago. It may have been longer, but today's stats are really proving that's a correct statement. And if you look at 2014, it was the year of the cyber breach in the news. That's actually what they labeled it. And they estimated that 97% of businesses have been breached. So it's a very large percentage now. Basically, he's correct, everyone. And in 2015 has become known, already 3 months in, has become known as the year of the healthcare cyber breach. And the reason for that was Anthem and Primera. 2014, you only had 8 million healthcare records stolen. In 2015, in the first 3 months, we've already had more than 91 million stolen. So it's been very active in healthcare this year. And the takeaway is cyber attackers are knocking. Are you prepared? In compliance challenges of 2015, so what action do you need to take? This sort of covers back what we talked about on the chart just a few minutes ago. What the OCR wants to see is a HIPAA security risk assessment performed. That will sort of set the stage of where are you, what do you need to do, puts a remediation plan in place, and you can start addressing the issues. And then the number of audits are expected to increase. They've actually suspended them for a short time, but they're expected to start back up here not long. And they're wanting to force the healthcare industry to step up and secure the data better. And one of the things to realize is if you're doing the right things and auditors ask you for information and you can provide that back, they move on to the next provider. So it just makes common sense. Start getting your compliance in order, and you start defending yourself from breaches and from audits and fines. So a security risk assessment is required. More compliance challenges, obviously, in 2015. We know that the healthcare industry is now the target of cyber criminals. So you might ask, why are they focused on healthcare? Why are they attacking it much more than last year? Thieves follow the money. So credit cards records, they're worth $10 on the black market. a complete medical record can be worth up to $500. They've actually seen proof of that, had those sold for that. And you might ask, well, why is the medical record so valuable? It gives the criminals the ability to create complete parallel identities. So they can now go get credit cards, they can get health insurance, prescription drugs, they can actually even get car loans or buy cars. There's all kinds of things it opens them up for because they can just create financial accounts. So the takeaway is EPHI is extremely valuable and you need to protect it. So I wanted to talk briefly about the anatomy of a cyber attack. We've actually heard a lot of this lately from clients and people in the industry we've talked to, and most people seem to believe that if you're attacked and breached, they've stolen your data. And that's not actually true. So the idea is the cyber criminals are looking for data to make money. And most people believe you need to have this, you got to prevent them from getting in the house, so you prevent the attack. But the next step is it takes some time to actually find the data and start extracting the data and get the data out of your facility, off your computers. So if you look at Anthem and Primera and all of these, you'll see it actually took them, we don't know how long they were attacking them. They could have been working on the attack for months or years. But once they gained access, it took between 10 to 90 days for them to actually start pulling data out. So there's actually some time there. And then once they did start pulling the data out, it took them a while to get all the data. So it's not like they go in and they pull all of your data at one time. They keep pulling data over time. And this would be true even in small shops. So this isn't millions of records. They're just not going to go get all the data at one shot, basically. So the takeaway is the breach is the beginning. It takes time to steal the PHI, the EPHI. So the anatomy of a cyber defense is obviously to work against all of this, against the cyber attackers' forces. So you start out with prevention. You want to keep them out of your house, out of your shop. But that's difficult, it's expensive, and it fails. We see that in the news that these people got breached and they had their data stolen. The next step is to actually detect that somebody's on your system that you don't want on, some piece of software or something, and then you want to stop their action of acquiring your data. That's also difficult. The tools that are out there create a lot of noise because they're telling you everything that changes, and unfortunately humans ignore those things. So our suggestion actually falls back to HIPAA compliance. We believe that you need policies and procedures, and you need to define what you're going to do to prevent these things and have a prevention plan or data security plan. You need to encrypt the data. So if they do steal it, they get encrypted data. They usually won't take the time to decrypt it if you've got good encryption. And then you want to make sure that your prevention is good and current. We see a lot of times we'll go into clients, they have antivirus installed. It's not installed on 100% of the systems, and the definitions are not up to date. So you need to make sure everything's properly taken care of there. It's back to the trust and verify statement. And on the detection side, you need to make sure the integrity of the system is what you expect. You need to make sure the vulnerabilities that are known to the systems have been updated, so you remove them. You want to make sure the system profiles are set up to be compliant, so they're requiring the correct type of logins and passwords and things of that sort. And then you want file integrity monitoring and system integrity monitoring to make sure the system is in the state you expect the system to be in. And this is where SignaCert comes in. We found this tool about a year ago, and they bring this bar that was out on the right near the data up against the point that when they breach your systems, you can detect them much faster. And SignaCert does that by removing the noise. So you only see the things on the systems that don't belong there. They show you that in the report. It improves the detection of these things. And in doing so, it'll help your IT department or MSP harden your systems, and it allows for a much faster response. So the takeaway from this slide is breaches happen. They're going to happen. We know that. But data loss can be prevented or greatly reduced. And I want to turn it over to Tony now and let him talk about SignaCert and how they do that. So Tony, I will drive the slides for you and let you have it.
Sorry about that. Small technical difficulty. This is JT Keating. I'm stepping in for a quick second. Before we hand it over to Tony, thank you again, Robert. That was excellent. I just wanted to remind everybody again to please put your questions in. We've been getting some great questions already, and I'm sure as we roll through some of those other parts, we're going to be getting some more. So with that, here's Tony Jennings.
Okay, great. I promise to keep this part short so we can get to the questions. But Robert, go ahead and fast forward. Go ahead and build the whole slide for me, please. So I think we can all agree that in a world where you're either you will be breached or you are breached, and it's going to take you up to 9 months to get for you to detect that breach. I think it's important for us to understand that mean time to detection is really what we're trying to do. We're trying to detect things as quickly as possible so that we can reduce our risk and mitigate as quickly as possible, reduce our exposure. So at SignaCert, we've developed a way to essentially get rid of a lot of the noise that's typically inherent in monitoring solutions, and to allow you to very quickly remove the hay, find the needle, find the thing that needs to be remediated as quickly as possible. Next slide, please. Okay, great. So at SignaCert, we call this continuous integrity verification, which really just means we have developed some unique technology that allows you to very quickly determine whether systems, your IT systems have drifted from a correct or a known good state. And really, this is key. The fact that we're really monitoring for correctness versus change is key to removing all the noise. You know, a lot of change that happens in environments are not bad. You know, a lot of changes are good. If I'm patching a system, I really want that to happen. So you don't need to be bothered from an alerting perspective every time anything changes. There really needs to be a distinction between good change and bad change, or change that should have happened that didn't. And this is all about really understanding. This is what this notion of correctness versus change really gets us. So we'll hit on this again here in just a second. Go ahead, Robert, to the next slide, please. The way we do continuous integrity monitoring is with it's a patented correctness engine. It really has kind of what I might call 3 pillars or 3 roots of trust, if you will. We have technology, and we can obviously, you know, if you would like more depth on this, clearly please contact us. We're glad to dive more into actually how we do this. But at the end of the day, what we are able to do is very quickly determine across your IT systems, and by systems I mean desktops, servers, routers, switches, databases. We have a broad range of infrastructure we have the ability to monitor to make sure that you're HIPAA compliant or that you're secure. But we have really 3 filters we put on that. One is the ability to tell across that infrastructure whether you have legitimate trusted files running in your environment and whether you don't. We have the ability to very quickly determine if you have based on trusted reference templates is probably the best way to put it at this point, to compare your deployed system against trusted reference templates for the particular system type to tell you very quickly whether that system is configured correctly or not, whether or not it's in a correct state. So trusted applications, trusted systems, and finally we have a series of, I guess, trusted benchmark tests is the best way to put it, that allows us to compare deployed systems against a set of benchmarks. In this case, the set of benchmarks would be whether your IT systems and controls are HIPAA compliant or not. So using those 3 filters, we have the ability to tell you at any given time whether you've slipped from a correct state to an incorrect state, and we alert on the incorrect state, not the correct state. So very quickly you end up with a notion of where in your enterprise you've moved from a correct state to an incorrect state, and tell you about that incorrectness so you can react to that very quickly. Advance the slide, please. So what you get from that, quite frankly, is the ability to be continuously compliant. Think of this as a way to have ongoing, continuous self-assessment or audit, which obviously does things like reduces your exposure, reduces the effort necessary to get ready for annual audits, etc., because it obviously prevents the evidence that you need to attest to the fact that you have been HIPAA compliant and or exactly where you are relative to your HIPAA compliance as it pertains to your IT controls. Clearly, because we take a correctness-based change detection approach, it really reduces most of the noise associated with these sorts of systems that you've typically seen, which reduces your mean time to detection, and most importantly, reduces your total cost to detect as well. So that is my real quick commercial, and I think we are ready to move on to some additional questions at this point. Thanks for your indulgence.
Thank you, Tony. Yeah, some quick takeaways is when we talk to people, it's like do the right things. Just protect your patients, protect your customers, which means protect your data, which is back to HIPAA compliance and security prevention. Good business sense, obviously. OCR audits are here to stay. They actually are planning to ramp back up. So 2015, they're supposed to have more than they've done in the past, and you have to be aware patients are filing complaints. And then breaches are happening more frequently. It's only a matter of time before you are affected. And then monitoring your system's integrity is a necessity. So with that, I think we're moving to the questions and answers.
Thank you very much, both Robert and Tony. I definitely appreciate it, and thank you, everybody that's been sending questions in. And so I'm going to start popping through the questions, and then kind of going from there. And then if you have questions, continue to send them in. So the first one, Robert, is for you. It comes from Brad. And Brad asked, do you feel that FaceTime and Skype are HIPAA compliant for telehealth consults?
So I'm sorry, you broke up on the first piece of software. Which one?
FaceTime and Skype. So basically, the ability to do voice and video, over the web. Do you believe those are HIPAA compliant for telehealth consults?
Those have actually been discussed, and actually our compliance officer, who may be able to join in and answer that. My understanding is there's discussions around both of those. So the short answer is I would advise not to utilize them unless you can have proof that they are secure and compliant. There's arguments that they are, but there's examples of them being breached. So I don't know if it answers the question well, but that's a common problem with some of the tools out there. So you really want to make sure it was built to do that, and it encrypts the data or encrypts the conversations. The other way to get around it is not talk about PHI type things, but if you're doing telehealth, you probably are.
Perfect, appreciate it. I have a question that Michael asked, which I'm sure a lot of other folks have asked, about getting the slide deck. We will make the slide deck available to everybody in PDF form, so thank you for asking that, Michael. We'll send an email out with that as a follow-on to this conversation. So I have a question here for Tony. I'll just keep bouncing back and forth to kind of keep everybody having some fun and interested. This one comes in from Mike, and he said, I use Tripwire's thin product, and there are too many alerts. How are you different?
Okay, that's a great question. Again, I'll say that a large part of our installed base were Tripwire users at one point, and this is a common problem we hear with Tripwire. But again, this is exactly what SignaCert was designed to do when we're monitoring for correctness versus change. It simply eliminates most of that noise and allows you to very quickly, when you get an alert, it's something you need to pay attention to versus getting an alert on simply everything that happens across your IT infrastructure. Clearly, that's just too much noise. You're overrun with information, and this is exactly what we're designed to do. To essentially give you the tools you need to filter out, and get to the information you really need very quickly. That's what we're all about.
Perfect. Thank you. Robert, another question for you. So under the new rules, is there any real difference in security rule requirements between covered entities and their business associates? That comes from Jonathan.
Yeah, and again, our compliance officer knows the dates, and I apologize for not remembering these, but several years ago, in fact, I think that was the most recent, 2014, you now are expected as a covered entity to verify that a business associate with access to PHI or ePHI has done a risk assessment and is compliant. So they actually need to go through the same steps that you would go through as a covered entity. And you need proof of that and sign off of that, and it should be in your business associates agreement now.
That's correct, Robert. Sorry, it took me a little while to get on the line, but a business associate is required to act like a covered entity and perform all the same levels of security to protect the PHI, just as if they were a covered entity.
So thank you, Ed. That's Ed Jones, who's the compliance officer for Third Rock, and we had asked him to join just for those kind of questions because he doesn't want me to answer you incorrectly.
None of us want you to answer incorrectly. So that is awesome. And Ed, thank you very much for hopping on. Okay, here's another question for you. When it comes to an EMR that is SaaS-based, so software as a service-based, how does Third Rock's recommendation change at all? There should be security parameters in place per our SaaS agreement, correct? Oh, sorry. There should be security parameters in place per our SaaS agreement, correct? So basically, how is it, and that's from Megan. Thank you, Megan. When it comes to the EMR that is SaaS-based, how does your recommendation change?
So Megan, that's a really interesting question, and we probably have to be careful how we answer it because we go into some places. An example would be we've gone into shops that have a EMR on-site running on their servers, and when we go and we actually use SignaCert to do an initial scan so we have 100% coverage of knowing if the systems are compliant and finding problems. We've gone into those on-site servers, and we found that the raw PHI, unencrypted, is sitting on every client that accesses that tool. So in that sense, you may say, well, having it local is better, but we found instances where it's actually not. It's extremely bad. So the same thing applies if you move it out into a SaaS environment or a cloud environment. It's back to making sure that the cloud provider or the SaaS provider knows what they're doing. They can prove to you what they're doing. And I would say one of the requirements is they need to be running tools that are verifying the integrity of their systems. And then obviously from your question, it sounds like you've got to make sure you're secure of getting to that data. So there's questions when you start using web interfaces, accessing web applications, is that really secure? Can it be hacked into, things of that nature? So it becomes a pretty broad possibility. In general, we like co-location. We like SaaS solutions. The reason is you transfer the liability out to the SaaS companies, and you greatly reduce your on-site staff needs to maintain servers. So it depends on the size of the company, depends on what you're trying to accomplish. So I hope that answered your question.
One additional thing there, Robert, this is Ed Jones again, is one of the challenges of cloud-based solutions is the contingency requirement that HIPAA brings to the table. And you've got to be very comfortable that you have contingencies in place that will allow you to bring your patient's data up in a sufficient amount of time to protect, to make it available for your patients. And we've had a number of customers who have failed that test or really couldn't prove that they could get back up, and there was a failure and they couldn't get back up in a timely fashion. So that's something to consider as well.
And thank you, Ed. That's a really good point. And that can work both ways, Megan. That can be if you don't have a good definition of your RTOs and RPOs for recovery time or recovery point objectives, then a SaaS solution may be beneficial to you. And on the flip side of that, if you do that very well, you know how to run your systems, and you go with a SaaS provider that doesn't have a good contingency plan put in place, then you could get into a worse situation.
Perfect. Thank you, gentlemen. Now we'll shift gears back up. Well, actually, I had one more, again, tactical question that came from Alphonse, and he was asking, will the webinar be available in recorded form? And the answer is absolutely. When we send out the PDF, we'll include a link that includes the archive as well. So thank you for asking that. So Tony, back over to the SignaCert question. This came from Dan, and he said, how is this technology different than vulnerability scanners or like technology?
Yeah, that's a great question. We actually have a vulnerability scanner, a client-side vulnerability scanner built into our product, but it's just a subset of the capabilities and what's required from a HIPAA, or in most compliance cases, vulnerability assessments are just part of what you need to do. What we're actually doing is actually beyond a vulnerability assessment, making sure that the IT controls that are required per HIPAA or any other compliance mandate are there and operating correctly. IT controls could be things like, do you have antivirus installed? Is it at the correct definitions level? Are you at the correct patch level? Are you running the correct password strength? There's a number of other things that are required, many tests that are required beyond just vulnerability scanning to make sure that you're HIPAA compliant and that your IT controls are in place and present. So great question, but that is a common misconception, so I'm glad that question was asked.
So Tony, while you're on the mic, we have a question from Jen, and she asked us a simple, straightforward question of, do you have reports that are accepted by HIPAA auditors?
The answer is yes, obviously, yeah. They are accepted. Again, at the end of the day, HIPAA auditors are looking for evidence that you understand what your compliance posture is, and that at any given time you're improving that posture. So yes, the reports we have are accepted by HIPAA auditors.
So JT, if I can jump in on that for a second. So we do HIPAA compliance. We go in and do the assessments to prepare you so if you do get audited. So one of the nice things about the tool that we like is they use these NIST and there's various other tests that are out there to check HIPAA compliance. So one of the things you can do is just show that these are the 110 things that are verified in a PC or server profile to make sure this system is HIPAA compliant. And that's one of the reasons we liked it. And back to the previous question, it does the vulnerabilities, the compliance, and the FIM and SIM checking. So you get one tool that really covers your integrity type solution.
Thank you, Robert. Thank you very much. And now, coming back again to your side of the world, again, since you're on the mic, if I keep using that. This question came in from Dan, and it's another similar question that you and Ed fielded just a little while ago around the kind of the difference between covered entities and business partners. And I think a lot of these questions are great because a lot of times, whether it's in the some of the HIPAA breaches, but also in some of the PCI, most notably, the target one, for instance, a lot of times it's the partners that actually get taken advantage of as an entry mechanism into the larger entity. So the question is, does the risk assessment requirement only apply to covered entities, or does it also apply to business partners?
It does apply to business partners that are determined to have access or may have access to PHI or ePHI, so physical records or electronic records.
Okay, and then another question for you. This one comes in from Donovan. And folks, we're starting to get down on a few of the questions we have here, so now would be a good time to put your questions in if any of them have kind of spurred some additional thoughts of yours. So this one came from Donovan. And it says, would you recommend going with an outside server farm versus an in-house solution as far as reducing risk of breach? And actually, I'd love to hear your thoughts on this, Robert, but then, Tony, from your Air Force information warfare and your security experience, I'd love to get your perspective on this as well. So it's the outside server farm versus in-house solution question.
So, Tony, if you don't mind, I'll jump first, and then you can
go first. I've got my own thoughts, but I'd like to hear yours as well.
Yeah. Well, so I would start out. I'm taking the scapegoat or the exception answer of defining a server farm. Let's assume you're talking about a secure, encrypted, cloud SaaS solution, basically. Maybe would be the ultimate side. I think it's back to my previous answer. If it's done correctly, it's actually a feasible option to go do, and there's multiple reasons. There's some business reasons which transfers liability to those people for the contingency side of this and the data it's at rest encryption side of it. So it sort of depends. Believe it or not, it comes down to some part of this becomes a CEO and CFO business decision. The other part becomes how well do you trust a SaaS solution or a server farm solution? And then how well do you trust your own in-house solution? Now, if you're not talking about SaaS and you're just talking about putting your application running in a co-location server farm, sort of the same things applies. How well is that colo facility going to set that up? How secure is their system? How good is their encryption? So you have to know what you're doing, which can take off some maintenance personnel issues, but it still leaves you with determining and testing and making sure that it's going to work properly in a server farm.
So let me just add my comments there. So I think, Robert, you really kind of hit the nail on the head. At the end of the day, like the old paranoid security guy part of me says, no, don't put it outside. But at the end of the day, it really depends on how well the hosting firm understands, what your security and compliance requirements are and whether they're implementing those IT controls or not. If you have a partner that understands and takes the same level of care and diligence that you do, then I think assuming you are diligent and taking care, then I think you're fine there. I would say that there's folks out there like Firehose that offer that as a differentiation over other hosted folks. Basically, they take care, they understand things like HIPAA and try to make sure their infrastructure is compliant in the appropriate way. I will also say that SignaCert is in the process of signing on with several very, very large managed service providers that also want to be able to provide, that as a differentiation to their folks as well. So stay tuned. You'll see some announcements over the next few months about some partners that we are partnering with that will be using our technology. But the answer is it really depends on who your outside hosting provider is and how well they understand, these standards and so forth.
Perfect. Thank you, gentlemen. We have another question from Megan. And so Megan's question is, does a DR tool with access to resident data offline suffice to cover the concern from Ed's comment about being able to access resident data in a timely manner? Would you like me to read it again?
Yeah, I'll read the first part.
Okay. Does a DR tool with access to resident data offline suffice to cover the concern from Ed's comment about being able to access resident data in a timely manner?
So I will answer it two ways, and then Ed can correct both of them, or I can answer it in two parts. The first part is how soon do you need your data back? So that depends on the type of facility you are. An emergency room needs to be able to recover much faster, so their RTO is much quicker. Recovery time objective, how long can they be down? The other thing you have to do in a contingency plan is remember it's worst case scenario. Your servers will not go down Friday night at 5 p.m. when you don't have any patients for 48 hours. They're going to go down at Monday at 9 a.m. when there's 20 patients in the waiting room. So that's the first thing. You sort of have to define your environment. I think if the DR tool gives you access to probably read the records and provide service, then you're okay. I don't know that that's back to the sort of having to know your practice a little bit. I don't know that you have to have edit capabilities or update capabilities. You would have to have a way to, if you do scripts and things like that, you're going to have to be able to process those to I would just use the general term, be compliant to provide proper service.
Perfect. Ed, anything else you wanted to add with that, or was that?
No, I think that's, it boils down to the availability and integrity of the data, and if the tool provides that capability so that the data is available for the doctors to address the concerns, then it probably is sufficient, as long as the tool doesn't introduce any additional vulnerabilities in terms of the process that gets you. If that is a secure process that doesn't reduce the security of the data.
Perfect. So we just have a few more questions left, folks, unless anybody else toss some more in. Here's one that kind of takes us in a little bit of a different direction, and this comes from Jake, and it says, can you explain what policies and procedures are and how I create them?
So I'm happy to take that on. Policies and procedures are basically, the policies are rules for how your company operates, and procedures are the steps you go through to attain those, to make those rules happen. And so it can be as simple as, for instance, setting the time on your computer that has access to the EHR system that it times out in 30 seconds after you inactivity. So if you set up a policy and procedure that says all laptops will be set such that they'll time out, that's what you have. Then you operate against that, and then if you're audited, then that policy is in place, your procedure's there, and your people have been trained against that procedure or that policy, and that's what the government's looking for. So a set of policies and procedures actually has to cover the HIPAA security requirements, which are documented in the CFRs, and there are required things that have to be covered and things that are called addressable. Addressable is not optional, it's just that you can either cover them one way or you cover them another way, or if you choose not to cover them, you have to document why. And so there's based on, we strongly recommend that your policies and procedures reflect the way you do business, because if you just buy them off the shelf, some across the internet, and you try to apply them, they will not improve the way you do business or you improve your business efficiency. So my quick 2 cents.
Perfect. Thank you very much. So we have 2 questions left. One is, door number 1, which is probably for Tony, and then door number 2 is for the Third Rock gents. So we'll go with door number 1 first. So Tony, this one comes from Gary, and it says, in the real world, if we're using SignaCert, how long would you expect it to take to uncover if we've been breached?
Again, another good question, and of course, assuming that you're using you're using all 3 filters, it's just going to be a matter of what your scan interval is. If your scan interval is, and again, really customer or situation specific. In some cases, customers want to report once a day. They want us to scan and report once a day. Some cases once a week. In some cases, it's once a month. So it really depends on how frequently you want to essentially scan or essentially audit your environment. Again, this is continuous. It's automated. You just say, I want to know once a day, once a week, once a month, and that would essentially dictate how quickly you discover a breach of some kind. So great question.
That is a great question, especially when you juxtapose it against the current industry standard is stated at 243 days from exploit to discovery of the exploit itself. As Robert was talking about earlier, guys like Primera stated that it was a 9-month process by the time that they had actually gotten hit, so even a little bit longer than 243 days. So anything you can do to shrink that down is obviously critical. Now, the last question we've got here is back again, Robert, to you. And this comes from Bob, and it says, you mentioned 10 steps to HIPAA compliance. What are the first 3 you suggest doing?
Yeah, we actually define that as our, so thank you for that question. It's a perfect lead-in for our high-impact solution. So the first one is you need to start with a risk assessment, and it needs to be a complete risk assessment that you go through and objectively check to see where you are against the compliance laws or requirements. And then the next 2 is if you're sending EPHI, you definitely want to make sure you're using encrypted email, and the government has actually created a new standard called the direct protocol email that you could use, usually for hospitals and communities of providers that would interface together to use that tool. And then the third thing, which actually may be the first thing you'd want to implement out of the 3, is a continuous network monitoring solution, which is actually why we were happy when SignaCert was interested in working with us on this presentation. To give you an idea, it actually goes back to the previous question of how long do you want to monitor, how often do you want to monitor your systems, or how long till you detect a breach? Can SignaCert do that? If you asked us that question in the middle of last year, we had told you in a small, let's just take a doctor's office, we just said we turn SignaCert on and we run monitors once a month, back to noise. Even in SignaCert, it doesn't have noise really. It's just somebody to monitor it, because the small shops don't have extra people sitting around dedicated to monitoring logs and stuff. If you ask us that today when we bring it in, it runs every weekend. We don't even want an option with you. We're like, you just need to make this run every weekend at a minimum so that we catch this and can help resolve the problem. So I think the 3 primary is risk assessment, SignaCert, scanning your systems weekly, and email encryption.
Perfect. Well, with that, folks, we're out of questions, and we want to be very respectful of your time. I want to thank both the presenters again. Thank you very much for your insights, and Ed, thank you for coming in and providing the additional color commentary to make sure that everything was kept down the straight and narrow on that part. Definitely appreciate it. And again, folks, we'll be sending you an email with a PDF of the slides, and it will also include the link to the archive so that you can watch it, share it, enjoy it as much as you want. And then, as you can see from the slide here, if you have any questions or would like to engage with us in any way, shape, or form, feel free to shoot us emails at each of the respective places. And with that, I would like to thank you for giving us your time.